Hi guys, this is Sam and Emma from Podipedia, and today we're going to talk to you about Achilles tendon pain.
The Achilles tendon is the largest tendon in the body and effectively runs from the calf muscles down and connects into the heel here. We get loads of patients coming in with problems in there.
We do indeed. So what you will probably find as a sufferer of Achilles tendon pain is that stiffness first thing in the morning when you get out of bed and you try and walk and you feel this really nasty, grindy kind of pain in the back of your heel. And also you'll find this after periods of rest. So after sitting at your desk for some time or sitting in your armchair in an evening and you get up suddenly to go and make a cup of tea or something and that stiffness is back. It's after sort of periods of rest. It's pretty nasty.
Definitely. Some people feel the problem in the actual connection where it goes into the back of the heel. Some people feel it more in the body of the tendon up here. Just completely varies. Sometimes it's accompanied with pain and swelling in a certain area. Main sort of things that we tend to encounter is either in the early stages it's often more of a tendonitis, more of just an inflamed area, but there's a lot of research being done about the tendon and actually it not being an inflammatory problem. So we tend to often see more of the condition where the tendons become thickened.
Yeah, sort of degenerative and not functioning very well at all.
It's something that can become really, really chronic as well. So our advice is to get it assessed early on. If you get any pain in the back of the heel, maybe you've worn a pair of bad footwear or sort of done some activities that have aggravated it, a pair of flip-flops for gardening or something like that. Yeah. Immediate things is try and wear some more supportive footwear, try and work out what's caused it and stop these problems. But if it becomes something that's there a few days in a row, go get it assessed.
Absolutely. It's also really important to say that if you injured yourself and you felt a ping or you heard an audible sort of snapping sound or you felt like someone hit you across the back of the legs with a stick, it could have been a ruptured tendon. When you have that, you typically lose power, so you can't go up onto your tiptoes, and it's not always painful, a ruptured Achilles tendon. So if you felt and you experienced something like that, do go and get an emergency appointment with a doctor or a podiatrist, or indeed get yourself to A&E and get it assessed very quickly.
Yeah, it's a very different sort of problem to an Achilles tendonitis or tendinopathy or tendinosis when it's ruptured or torn is something that needs more immediate treatment for sure.
Absolutely.
The other thing we're saying treatment-wise, what can we do?
What can we do? Well, we can do lots. So there's footwear modifications. That's often something that can cause or kick off an Achilles tendon problem is poor footwear. But as a podiatrist, we will be able to fully assess you, of course, and then maybe offer some orthoses, some exercises, and then indeed, if that doesn't help, then we can move on to some more advanced treatments.
Yeah, strength and conditioning programs are a really big part of it as well. Yeah. Looking at loading the tendon and trying to improve the sort of, try and get strength around the area improved, which sounds a bit counterintuitive when something hurts, and the loading programs can actually cause pain and discomfort. We get a lot of people coming in saying, oh, I was given some exercises and it hurts, so I've stopped doing them, but it needs to be taken very sort of slowly and cautiously, but actually the exercises often do cause some discomfort. So
absolutely.
Certainly more sort of if it's something that's not responding as well, treatments like shockwave therapy, possibly needling, steroid injections or high volume injections into the area, different sorts of imaging techniques can be used. So loads of things that podiatrists can do to help you guys, but we need to see you early on.
Yeah, and in some extreme cases, if we can't get it better, sometimes surgeons will do a surgery on an Achilles tendon.
Surgeons will do a surgery.
They will do a surgery. They love to do a surgery. But yes, that might be indicated in the later stages. But that's pretty rare nowadays.
And your sort of podiatrist can guide you to when they think that might be appropriate and liaise with a surgeon as well. There will definitely need to be imaging, MRI scans, that sort of thing involved in that as well. But
undoubtedly.
And how do people find a podiatrist?
You can go to the Podipedia website and pop in your address details, and you'll find somebody locally to you who'd be able to help you.
If you enjoyed this content and want to see more videos in the future, hit subscribe and we will see you soon.
See you later.